Magandang buhay everyone! My name is Angel Gashala and Camarce and I am the nursing student here in Emiraginaldo College. And in this video, I will be demonstrating the proper bag technique as practiced in community health nursing. But to begin, let's define the bag technique and understand its significance.
The bag technique is a method in community health nursing that ensures the proper use of the nurse's bag during home visit. It prevents cross-infection, promotes efficiency, and keeps supplies organized for immediate care. So here are some of the things that you will find inside of the OB bag.
Upon arriving at the client's residence, I start by respectfully greeting the client and introducing myself as a nursing student. I then verify the client's identity, observe the surroundings for safety and cleanliness, assess for any urgent needs, and explain the purpose of my visit to establish rapport and trust. Next, I request a clean, flat surface such as a table or a bench on which to place the bag. If none is available, I may use the floor provided that it is clean and dry. Magandang araw po ma'am, ako po si Angel Gashala and Camarce, a student nurse po from Emilio Aguinaldo College po. At ngayon po, magko-conduct po ako ng home visitation and bag technique po. At kung maaari po, mag-assess po ako sa inyo at kukunin po yung family health history nyo po. Pwede po ba or maaari po? Sige po, salamat po ma'am. Matanong lang po ma'am kung maaari po ba akong humiram po ng kahit flat surface po na kahit table or bench po kung saan pwede ko pong ilagay po yung aking mga paraphernalia or aking kagamitan po para po sa assessment na ito. Meron po. Sige, salamat po.
Now that we have been provided with a table, we are first going to prepare the necessary linings to ensure that we are preventing contamination of our supplies. Next, I will position my bag on the left side, making sure that the straps are secured underneath to avoid touching unclean surfaces. I then open the bag carefully, removing the soap dish, and hand towel. I close the bag right away to limit exposure, and after this, I will now perform proper hand washing according to the standard procedures. Now that we are already done with hand washing, I will open the bag again and remove my disposable apron. ensure that we are putting the apron properly to shield our uniform from possible contaminations. For this demonstration, I will be performing the Benedict's test. So the Benedict's test is a method used to detect the presence of simple carbohydrates. It identifies reducing sugars such as monosaccharides and certain disaccharides that contains free aldehydes or ketone groups. Benedict solution is also commonly applied to check for glucose in urine. I will now select the only essential supplies for the procedure, thereby maintaining order and reducing the likelihood of exposure to contaminants, such as the waste receptacle, the Benedict solution, the alcohol, cotton balls with isopropyl alcohol, test tube holder, alcohol lamp with alcohol, and lastly the test tube. Now that we are already done with the Benedict's test, we are now going to proceed to disinfect all of the items that we have used in this procedure. Now, we are going to label an imaginable barrier between both sides. The left side will be our clean side, whereas the right side will be our contaminated side. Once the procedure is completed, I conduct hand hygiene once more. Upon loading our items back inside of the bag, we are going to use the alcohol for added infection prevention. I then remove my apron with caution, ensuring I avoid contact with its contaminated surface. Since this is a disposable apron, I will now properly dispose it on its proper disposal. I then proceed to put the soap and the towel inside of a plastic bag. I then put out my plastic bag where I will dispose all of the contaminated items.
After fixing all of these items, I record all of the pertinent details from the visit, such as observations, interventions carried out, and the care or treatments given.
That's all for this video. Stay tuned and thank you for watching.